The insight about the power of connectivity and understanding just how many supports and services and resources are out there that are like truly in some cases waiting to be capitalized on. And just understanding more that there's not a lot of forums to bring those together in a way that really focuses on issues. So that insight on a general perspective was what was sparked for me. I think more specific to cannabis use in pregnancy and for breastfeeding parents, you know, there's just so much that I think also is impacted regionally that in some sectors we don't even know. And so it was valuable to have people around the table from patient experience, from different areas with different backgrounds to really just bring a really thoughtful and engaging conversation together. It feels easy just to kind of go to a place where you think of like evidence-based co-design with families, but I do think that we need to think about it in ways where we can, as a healthcare setting and sector and social resource sector, go to the people who are experiencing the spectrum of the nuances we've talked about today. So from an action perspective, you know, kind of understanding what unique groups would we need to really formulate an approach that might not look the same for each one of them, because I think, you know, we know that we have very vulnerable community members who experience, you know, racialized issues, experience, you know, lack of access to care, their engagement, their understanding, whatever it is. I mean, that's one sector, but we also know that there's others who, as we talked about a little bit more on the first day, who are, you know, middle class, upper class, you know, are using it more recreationally perhaps, or for medical reasons, and still have concerns around stigma. And for me, that's something that, you know, will require a tailored approach and a thoughtful approach, and probably a lot of consideration as to who and how is facilitated. And to me, as a next step, bringing, you know, a multi-sector task group together, I think would be really valuable, because we could leverage the connections that already exist and the confidence in our family and community partners to participate, because I think that that's going to be like a huge first step, is talking in that language to make sure that people feel comfortable and safe to at least even open up.